Welcome to video 32 of the BDS mini-series, featuring one of the most universal symptoms of human experience, pain. Pain is one of the main reasons people seek medical help. But although we are all familiar with it, we rarely stop asking ourselves what it truly means. Is pain only a physical problem? Is it simply a mechanical failure of the body? Or can there also be a biological, emotional, and existential meaning behind bodily suffering? At Pharo Integral Method, we do not deny the importance of Western medicine or rigorous clinical evaluation. Pain can have multiple causes: inflammatory, traumatic, infectious, neurological, autoimmune, degenerative, tumorous, metabolic, or even serious medical emergencies. Therefore, no serious approach should trivialize pain or reduce it solely to emotions or psychological conflicts. At Pharo, we do not work against scientific medicine. We work to broaden our understanding of human suffering. Because often the body also expresses internal conflicts, accumulated stress, emotional tension, or existential overload. And that's where the integrative approach begins. Dr. Hamer. Pain as a biological program. From Dr. Reich Gerd Hamer's biological perspective, pain is part of a biological process of adaptation or repair. Hamer observed that certain symptoms appear associated with intense emotional conflicts experienced in isolation, with drama, and without immediate resolution. Depending on the type of conflict, the tissue involved, and the biological phase, different types of pain can appear. For example, muscular pain associated with feelings of worthlessness or powerlessness, joint pain linked to a loss of symbolic mobility or a burden of life, headaches related to territorial stress or psychological pressure, digestive pain associated with conflicts of not being able to digest situations, and chronic pain maintained by permanent states of biological stress. From this perspective, pain is not only destruction. It is a sign of repair, regenerative inflammation, or biological adaptation. Hamer also observed that during repair phases, edema, inflammation, fatigue, hypersensitivity, and increased pain can appear. This does not mean denying medical treatments or abandoning clinical checkups. It means understanding that the body possesses a profound biological logic that also deserves to be heard. At Pharo Integral, we don't interpret the symptom as an absolute enemy. We try to ask ourselves, what is this body trying to express? What emotional, existential, or biological burden is this person carrying? Jung. Pain and the shadow. From Jung's perspective, pain is a gateway to consciousness. Suffering forces the individual to stop, review their life, and confront denied aspects of themselves. Pain shatters the illusion of absolute control. In some patients, the symptom appears when the life sustained by the persona, the social mask, can no longer continue ignoring the deep needs of the soul. The body then begins to speak what consciousness does not hear. Wilbur. Pain in the four quadrants. From Akel's perspective, pain must be analyzed simultaneously biologically, psychologically, socially, culturally, and existentially. Reducing all pain to physical injuries is as limiting as reducing all pain to emotions. Human suffering is multidimensional. Traditional Chinese medicine. In TCM, pain is often interpreted as a blockage or disruption of the harmonious flow of qi and blood. Where there is no free circulation, pain appears. Sustained emotional stress, especially frustration, fear, or prolonged sadness, can profoundly alter the energetic dynamics of the organs and meridians. Taoism. Taoism teaches that the body loses harmony when a person lives disconnected from their deepest nature. Often, pain appears not only as a physical injury, but as a sign of a mismatch between the life we live and our inner truth. Existential dimension. Removing the mask. Pain often arises when we live too far removed from ourselves, clinging to masks, personas, external expectations, or identities constructed to please, belong, or survive. But there comes a point when the body and soul can no longer tolerate such inner distance. Growing up also involves learning to accept oneself, to acknowledge one's own truth, recognize one's own vulnerability, and present oneself authentically to life. Removing the mask is not weakness. It is a profound act of maturity and awareness. Because only when we stop pretending to be someone we're not can we benevolently develop our true identity and contribute to the world the unique richness that exists within each human being. Pharaoh Therapy. At Pharaoh Integral, we work with responsible interdisciplinary assessment, body awareness, stress management, identification of emotional conflicts, existential work, habits, breathing, conscious movement, and the restoration of body-minded soul balance. The goal is not to romanticize pain. The goal is to understand it without fragmenting the human being. Lighthouse Learning. Sometimes pain doesn't appear only to destroy. Sometimes it appears to force us to listen to what we've been ignoring for too long. Lighthouse Phrase. The body screams what the soul can no longer silence. Subscribe to the channel. Don't forget to like this video. Comment below where you're watching from if you're a healthcare professional, and let me know if you'd like to train as a Pharaoh coach. Share this video to help raise awareness. Study with ESSI, the Pharaoh Integral Method. Learn science with awareness. Because in healthcare, knowledge isn't neutral. It's vital. And if you'd like to address your emotional symptoms or suffering from Pharaoh's holistic perspective, you can contact me to schedule online Pharaoh sessions. See you in the next episode.